A lot of people think about someone losing their leg. They're picturing these athletes in the Paralympics who have prosthetics and they're doing things like running and jumping and that. Unfortunately for our patients who lose limbs, they don't do as well. So in my opinion, it's imperative that we do anything we can to try and save a limb in order to save a life. It's a fairly simple procedure. We make about a 10-centimeter incision directly over the tibia, over the lower leg, just above the ankle. And we take and we cut a cortex or a portion of the tibia and we create a window. Then we put 2 pins in that, 2 pins in the leg, and over the course of about a month, there's a dial outside the leg that the patient will turn twice a day, and it pulls the cortex away from the bone. We'll dock it there for a week, and then over the course of another month, we push that piece back in, and then ultimately take it back to the OR to take the pins back out. What we're essentially doing is creating a fresh fracture. The body is reacting as though it's got a broken bone. So the body actually forms new blood vessels in order to send blood flow to the spot that it thinks is fractured. And by doing so, we improve blood flow to the whole extremity. So with John, he had peripheral arterial disease where he had inadequate blood flow to his feet. And what we did first was we sent him to Dr. Davis, one of our vascular surgeons here, and she went in and did everything she could to clean him out. Unfortunately, his disease was so far progressed that there was nothing she could do to open him up. What's interesting about John, what made him a great candidate to try this, was John had committed that he was uninterested in a leg amputation and would potentially perish before he would agree or sign a consent for a leg amputation. So this procedure in this specific case was actually more than about saving his life than saving his leg. Leading up to surgery, we have probably about 6 months of photographs of his wound where we made absolutely no progress whatsoever. He is now about 6 weeks into the process. We did distract for a total of 4 weeks. We've held it in place for a week, and now for the last week we've been pushing the bone back in. The wound is almost completely healed. He went from probably the size of a racquetball now to smaller than the size of a marble.
Dr. Winky and his staff have just been wonderful. I mean, it's just been wonderful. When he told me about this procedure, I was excited about it. Like he told me it was my last chance. I have to do something.
When we did this case, we were about the 300th procedure that had been done in the United States. Most of them have been done on the East and West Coast, and we were the first one anywhere in the entire Midwest to perform this procedure. I'm excited both for John personally, and then I'm excited for the greater community that we've been able to get this procedure in. We've been able to get it going. We're going to be able to show people that it's effective. Also, I'm hoping that we can use it and save a lot more legs and potentially more lives here in Nebraska.